Hello, I'm Bob Modell, and welcome to Addiction and Recovery in Review this week, July 2010. Keeping you up to date with the latest news and developments in the area of addiction and recovery. Topping the headlines was the success of the first West Coast Symposium for Addictive Disorders, held at La Quinta Resort and Spa in La Quinta, California, sponsored by the fine team at C4 Recovery Solutions. With a turnout of about 400 of some of the top names in the industry, there were enough workshops and seminars to keep everyone active. Rick Orstrom, the Bulldog himself, was there to greet many of the guests as a lot of valuable information was presented to the attendees. On the same note, the Planning Committee is accepting proposals for workshops for the second annual West Coast Symposium in June 2011. Chris Schroeder, host of The Afflicted and Affected, was on hand at the conference where he caught up with Tony Messbarger, Director of Admissions for Origins Recovery.
Tony, what's the biggest challenge getting somebody into treatment when a family calls looking for help for a loved one?
Well, Chris, probably the largest challenge that I face in admissions is getting everybody on the same page. Corralling the family, to get everybody to get on the same page and to shut the addicted down, the addicted person down.
Where's the resistance come from usually? When is it the individual that doesn't want treatment? Is it the family dynamic that just doesn't want everything exposed? Or what are the issues?
Yeah, generally it's both. Most of the time, most of my phone calls come from loved ones that want it more than the family member actually wants it. So it's a little bit of both. But generally, it's going to be the resistance from probably 75% of the time it's going to be the resistance coming from the addicted person.
How does the deal close? What has to happen for everything to fall into place so that the individual's on a bus?
There's no enabling, there's no addiction. If we can shut the enabler down, the chief enablers, if we can shut the enabling down, then generally we can get the person pliable enough to get them into treatment.
It's important also to take away their ability to keep participating in the illness, correct?
Oh yeah, absolutely. One of the things that we do real well at Origins is we actually work with the family members while they're going through treatment. Because we know that we can do some great work with these individuals and send them back to the house, and they'll take the ribbon right off of it in no time at all if they've not been treated themselves.
Excellent.
The next big event is the Cape Cod Symposium in September from the 9th through the 12th, with a guaranteed huge turnout as always. In other news, USA Today reported the number of minors caught smuggling drugs from Mexico to Arizona surged 83% in 2009. Last year, 130 minors were arrested on drug charges by the U.S. Border Patrol, part of what officials call a small but growing trend. Cartels entice the youths, usually American citizens with family in Mexico, with promises of cash and light sentences if they are caught. Many of these teens are surprised when they receive serious jail time, officials said. One thing for sure, said Teresa Small, a Customs and Border Protection spokeswoman in St. Louis, they will get the hardest punishment possible. Methamphetamine users have unique treatment needs but typically receive the same type of therapy as those addicted to other drugs, reported the San Francisco Chronicle. If someone needs treatment now, they might as well go to any place for any kind of addiction because there's no specific treatment for methamphetamine, and the programs we have don't work that well, said John Mendelson of the Addiction and Pharmacology Research Laboratory at California Pacific Medical Center in San Francisco. We're learning that methamphetamine is not heroin, prescription opiates, or alcohol. It's a different problem with a different set of treatments that are going to be hopefully effective. Other news, healthcare reform law gave a big boost to addiction treatment and prevention. Don't count addiction recovery advocates among those who see healthcare reform as Armageddon. The bill signed into law by President Obama on March 23rd includes addiction and mental health services in its basic benefits package and is being broadly praised by treatment prevention and recovery leaders. Treatment admissions are way up for the older Americans. The excesses of the baby boomer generation are starting to show up at the door of U.S. treatment programs, which saw admissions of patients ages 50 and older almost double between 1992 and 2008. Patients over age 50 comprised 12.2% of all treatment admissions in 2008, up from 6.6% in 1992, according to a report from the Substance Abuse and Mental Health Services Administration. Admissions for heroin use among this age group more than doubled. Cocaine admissions quadrupled, and significant increases in older Americans seeking treatment for prescription drugs and marijuana also were reported. This week on Afflicted and Affected, Chris Schroeder interviews John Lieberman, Director of Operations for Visions, an adolescent treatment center. This is Bob Modell from Addiction and Recovery This Week in Review. Wishing you a great week ahead. See you next time.